Welcome everybody, thanks so much for coming. I'm Sarah, I'm a social worker here at Intermountain Cancer Centers, and we're here today to talk about sexuality after cancer treatment. It's very common for patients and couples to have trouble and changes into their sex life after cancer treatment. I'd like to hear about some of the challenges that you're facing so that we can discuss some possible solutions.
Well, I'm a little embarrassed just even being here. But during and after my cancer treatment, I just don't ever seem to be in the mood. My husband has been very patient with me, but I know he'd like to have sex. Will my libido ever come back?
You know, this is a very common problem for cancer patients, both men and women. There are a lot of things in cancer treatment that can impact your desire. Worry, depression, nausea, just feeling tired can all impact your desire for sex. If your surgery impacted your hormone balance, that can also impact your desire for sex. The good news is that a lot of people have their sex desire return.
I just find it difficult to have any desire. I just, after the surgery or after my treatment, the way my body looks, how I feel, I don't feel attractive anymore.
Changes to your body can have a big impact on your sexual desire. If you had surgery to your breast, your genitals, your reproductive system, that can have a big impact on how you feel about yourself and how you look. Other types of treatment like radiation and chemotherapy can also have an impact on your sexual desire.
I feel the same way. I hate looking at myself in the mirror.
This is an issue that a lot of people deal with. The best thing that you can do is take some time to get used to your new body, the new you. Take some time to look at yourself in the mirror, touch yourself in different places so that you can feel what feels good to you and what doesn't feel good to you anymore. When you learn what feels good to you now, share that information with your partner so that you can find ways to be intimate that are pleasurable for you both.
I think part of the reason I'm not in the mood is because the last time we had sex, it really hurt. Now I'm afraid it'll always hurt.
Pain after cancer treatment is a very common problem, especially for women. There are a lot of things that can impact a woman's sexual functioning, and those are related to both surgery and to cancer treatment. One of the most common issues is a problem with lubrication, which is to do with the hormones, or surgical intervention that may have impacted your vagina can also be one of the biggest issues for pain. Water-based lubricants are especially helpful if lubrication is an issue, and you can also do Kegel exercises to help relax your vaginal muscles, which can help with pain. Keep in mind that being intimate doesn't always have to mean intercourse. That can mean caressing, touching, just being close to each other physically. Take time to explore what feels good to you. This may have changed from what you enjoyed before cancer treatment. Take the time to find out what's pleasurable for you and communicate that with your partner so that you can both adjust.
Since my treatment, I've had a hard time getting an erection. It's really embarrassing, and it makes me feel like less of a man.
Erectile dysfunction is a very common side effect of cancer treatment for men. The good news is that there are a lot of ways that you can treat that and achieve an erection. Those can include oral medications, mechanical devices, surgical implants. Many men feel the way that you do, but it is not a reflection on your feelings for your partner, and there are other ways to achieve intimacy.
I'm glad to know I'm not the only one experiencing challenges. It sounds like the best thing we can do is be patient with ourselves and communicate with our partners.
You're right, there are a lot of ways that cancer can impact your sexuality, but there are also a lot of resources available. Those are available online, or you can talk to your doctor. But either way, there's a lot available to help you deal with the issues that you're facing.